Can you press it one more time so the names come up? There's some animation in this one. So good morning, everyone. I'm Ron Brooks, and I'm an associate professor in the Department of Family Medicine. And the title of our grant is Implementation Strategies to Promote Equitable Dissemination of Long-Acting Injectable PrEP to Black and Latino, Latina, MSM, and Transgender women here in Los Angeles County. Just a little bit of background for this project. We know that historically, these populations, Latinos and Blacks, have lagged behind more well-resourced and privileged white gay male populations in receiving information about the latest innovations in both HIV treatment and prevention. And as a result, these populations of Black and Latino, MSM, and Transgender women have not benefited from early adoption, thus helping to create the disparity that exists today. Next slide, please. As an EHE supplement, our jurisdiction is LA County. The pillar that we're focusing on is prevention. Our intervention is Aptitude as long-acting injectable PrEP. The stages of implementation are preparation. And the research aims are to pilot and evaluate our implementation strategy, which is our community workshops. The framework is EPIS. Next slide. Our focus populations for this particular grant are providers, both medical and non-medical providers that serve our focus populations, as well as community members of our focus populations. The outcomes that we're looking at is reach of the populations and their service providers with information about long-acting injectable PrEP, as well as acceptability, appropriateness of the intervention and the community workshop approach, and then trust and confidence in the intervention. Our unit of analysis is providers and community members. Next slide. So we have three aims, and aims 1 and 2 are pretty much the same, and they are to increase awareness, knowledge of, trust, and confidence in LAI PrEP as an alternative form of PrEP for HIV prevention among providers, serving Black and Latino, Latina, MSM, and Transgender women, as well as consumers in those populations. Our third aim is to develop a strategic guide of community-derived and culturally tailored messaging that will help facilitate ongoing diffusion of LAI PrEP information to these populations in the hope that it will stimulate a community discourse about the intervention. Next slide. The project will be planned and implemented in collaboration with our community partners. We've identified and are working with 3 agencies in the meantime: Bienestar Human Services, Friends Community Center, as well as our key stakeholder groups, which is the LA County Commission of HIV and LA County Division of HIV and STD programs. Next slide. So for the community workshops, we will develop and implement a series of virtual information educational community workshops, a total of 7 across the 2 years, that provide accurate and up-to-date information on LAI PrEP related topics that are of particular relevance to both the consumers and the service providers that serve our populations. The goal of these workshops is to prioritize and preemptively build service provider consumer awareness, knowledge, and confidence in LAI PrEP as a new HIV prevention option for our focus populations in LA County. Next slide. So in developing the proposal, we came to consensus with our community partners on the first 2 topics, which is to provide up-to-date scientific and medical information on LAI PrEP to both providers and consumers. Topic 2 is to look at LAI PrEP policies, funding, and availability and accessibility here in LA County. And a third topic that we agreed upon with our planning group is a conversation with Black and Latino MSM community leaders about the significance of LAI PrEP for at-risk Black and Latino MSM and Transgender women in LA County. So topic 3, there will be 2 workshops, one for MSM and one for Transgender women. Next slide. Part 2 of our proposal is to develop a strategic guide of community-derived and culturally tailored messaging. And we will do that by holding focus groups with each of the 6 members of our focus populations. And the guide will provide recommended language, images, graphics, modes of presentation delivery, provide sample messages to support ongoing diffusion of LAI PrEP information to Black and Latino MSM and Transgender women in LA County. And I think that's it. Next slide. So if you have any questions, ask away.
Just post your questions in the chat, and then we will loop back around after all the presentations and answer their questions in the order of the presentations.
Hello,
Okay,
everybody. Should I start?
Yes, please do.
Okay, my name is Raiza Beltran, and I have Tam Fan with me. And I'm from UCLA HIP, and Dr. Tam Fan is a pharmacist at LA-LGBT and also an assistant professor at USC. And we are going to present our EHE project, and it is a long title, and it's Understanding the Implementation of SB 159, Pharmacist Delivered Pre- and Post-Exposure Prophylaxis in 3 high-priority EHE counties in California. And Tam will present from a pharmacist perspective the PrEP provision in the state of California.
All right, so we can have the next slide, please. All right, so good morning, everyone. I would like to start with a little bit of an introduction regarding PrEP and the utilization as well as the role of the pharmacist here. So with the PrEP product being the first PrEP product being approved in 2012 and the several products thereafter, PrEP has shown to be an effective chemoprophylactic intervention against HIV. And unfortunately, while there are approximately 1.2 million individuals at our increased risk for acquiring HIV and would benefit from PrEP, the CDC also estimate that only about 25% of those who would benefit are actually prescribed this very clinically effective intervention. So while even in high-income countries, we see several disparities in terms of racial, socioeconomic, and even health literacy disparities. And as one of the starking data that in 2019, we saw data that demonstrated that PrEP coverage is almost as 8 times better for white people than it is for Black patients. Next slide. Systematic reviews have also shed lights on several barriers as to access for PrEPs, and we can look at it from an individual to an intrapersonal, but in looking at the broader categories, we can look at it potentially from a deficit of quality and widely distributed information and education as regarding to PrEP, as well as healthcare professional biases or implicit biases when handling PrEP or PrEP therapy or working with the individuals or clients, but also looking at various structural barriers in terms of geographical locations for where PrEP could be available and where patients could get access to their PrEP and the time that it would take for them to get access to their PrEP. Next slide. And while the numbers of PrEP providers rose from 9,621 to about 65,000 there between 2014 and 2019, the potential of pharmacists have yet to expand. PrEP and PEP accessibility has not been realized since prescribing privileges only exist for those who have established collaborative practice agreements or protocols within their own institution for pharmacists to prescribe PrEP. And also the data from CDC approximates that about 90% of the US population actually lives within a 5-mile radius of a pharmacy, as to show the accessibility of a pharmacist. And I think over the COVID-19 pandemic, we have seen the role of the pharmacist transitioning from a more of a dispensing and transactional role towards a more client-centered, clinical service providing healthcare professional. And in 2019, an innovative law was passed in California, making it the first state in the country to authorize pharmacists this ability to independently initiate these highly effective medications without a physician prescription. This legislation, SB 159, also eliminated mandatory doctor visits and barred insurance companies from requiring prior authorization for these drugs necessary for PrEP and PEP. And as we can see, and based on the regional differences of HIV diagnoses, we really have to consider how can we get SB 159 and similar legislation, which is now has been passed by several other states, to be implemented in areas where potentially the clients would need it most. So I'll hand it over to Dr. Beltran to talk about our project.
Next slide, please. So our project really is to look at SB 159 in 3 high priority counties. Our primary objective is to identify the key implementation determinants, mainly the barriers and facilitators to implementing pharmacist delivered PrEP and PEP. And we're looking at PrEP versus non-PrEP deserts, so areas that seem to have lower access to PrEP. And then our secondary objective is we want to build this engaged coalition of key regional stakeholders to develop some locally based solutions. We'll include local public health officials and pharmacists, consumer groups, and community leaders in this effort. Next slide. So we have our project partners, that is the UCLA HIP and LA LGBT Center. And then we also have our regional partners. Dr. Brandon Brown is at UC Riverside, and Gabrielle Maldonado is the executive director of True Evolution. And True Evolution is an HIV service organization in the Inland Empire. Next slide. So I think there's some animation here, but it's Los Angeles, San Bernardino, and Riverside are the main places that we'll look at. And then if you can just keep on pressing, because I think these are the populations. And one more, the populations that we'll be focusing on really are people of color, sexual and gender diverse communities, and then the regional stakeholders and the pharmacists in these areas. Next slide. So this is a concurrent mixed method study. So what we'll do first is we'll really convene these coalition members and we'll conduct stakeholder interviews on the barriers and facilitators to SB 159. We're hoping to collect up to 60 interviews for the 3 counties. We'll also service pharmacists working in PrEP versus non-PrEP deserts. And we're planning on achieving about 300 survey respondents, licensed pharmacists within these 3 counties, which will be split between geographic areas of vulnerability. The key outcomes would be accessibility, feasibility, appropriateness, and cost of SB 159 implementation. And then one of the main objectives, we do want this to be a community coalition type of project. So we will work with members to look at the data that we are collecting and to see if we can work with them to develop these locally based solutions. And we're hoping to have this authentic engagement from members. We're hoping to identify implementation champions and develop local solutions. Next slide. This is just our project timeline that's within the 2 years and the activities that we're hoping to do within the 2 years. And then we can discuss that if you have any questions on this in the next slide. So thank you on behalf of our UCLA HIP and LA LGBT team. Thanks.
Great, thank you so much. Again, post your questions in the chat. People are responding in text there. We can jump on to our next lightning presentation.
Okay, great. Good morning, everyone. Dallas, just to confirm, do I have 5 minutes?
Yes.
Okay, I'm going to start my timer. Yeah, thank you so much for providing this opportunity. And I know that we have a short time, but at the end of my talk, please feel free to reach out to us. Recognizing the long title, one of the first things that I wanted to mention is we came up with our project name. Our project name is House of C.H.O.P. C.H.O.P stands for Choosing Healthy Options for Prevention/PrEP. Next slide, please. I wanted to first acknowledge our awesome team of colleagues. I know that my colleague, Dr. Carl Highshaw, is here representing the Ahmad Institute. And then we also have co-investigator, including Wen and Dr. Norita Milburn, and one of my colleagues from my division, Megan. Okay, next slide, please. Okay, so I'm just a messenger here, and I think the birth of this project came out of my discussion with the Ahmad Institute. The Ahmad Institute, they're very committed, and they have members and staff who are really embedded in the house and bulk culture. And the idea was to figure out how we can collaborate together to really engage with house and bulk community members. The reality is there's so many retention and support services that the Ahmad Institute provide, but there's still quite a gap in terms of the services, access to services. Ahmad Institute works really well with the Watts Health Health Center. I know Felipe is in the other panel, but they are very close in proximity. The Watts Healthcare Center, they provide PrEP program, but there's still a huge room for improvement. So, and with the opportunity from the EHE supplement, I would say that this wouldn't have been funded through a regular NIH mechanism, and I just wanted to show my appreciation for this EHE supplement, and I get to work with all these awesome members. All right, next slide, please. So what are the study aims? So the first aim is really try to figure out how we engage with the Haus and Ball community members to really explore some of the inherent barriers and challenges around PrEP, but also barriers and challenges around retention and support services that the Ahmad Institute currently provide. And I think one of the ultimate main goals for this initiative is to figure out how to train the Haus and Ball community members as peer ambassadors. And our hope is, this is a 2-year project, but beyond the end of the 2 years, our hope is to have empowerment and have Haus and Ball community members to continue as peer ambassadors so that they can engage with their members to seek services at the Ahmad as well as Watts. So the aim too is to figure out, after we train the peer ambassadors, we will engage with them through community partner participatory research by meeting with them on a regular basis to really explore how we can facilitate linkage and referral to various support and retention services. And then the aim 3 is like translating to uptake of PrEP care program. Okay, next slide, please. So this is just another representation of the aims. So the first aim, we're going to be exploring through this method called World Cafe discussion with 20 Haus and Ball community members. And then after that, we will be training them. And then with the Haus and Ball members as peer ambassadors, we will facilitate aims 2 and 3, support and retention services for the Ahmad Institute, and then the PrEP implementation. And I would say that in terms of the outcomes, we're looking at the health equity outcomes. So I think that one of the first thing is, how do we continue the capacity building of Haus and Ball community members as peer ambassadors? And the other 2 outcomes are more like process outcomes for aims 2 and 3, increasing engagement and ongoing social work related services, as well as for Watts, it's increased referrals to PrEP services. All right, I got half a minute. Next slide, please. All right, so first up, I wanted to let everyone know that we share this with our CHIPTS CAB members, and we had really great response and great feedback. We've been meeting bi-weekly. I also want to highlight the community partner participatory research. And as you saw in the beginning of the slide, that title was really, really long. One of the first things Ahmad Institute staff said, we got to come up with a name. So the way in which we came up with C.H.O.P was really iterative and collaborative. So, the word CHOP is very negative in connotation in Haus and Ball culture. When you compete and then you get chopped, it's really bad. So what we wanted to do was we wanted to flip it and make it more positive. So CHOP here stands for, choosing healthy options for prevention and PrEP. So and then before we start the World Cafe discussion, we are hosting Catch the Beat event that the Ahmad staff will continue to do, and introducing how we engage and introduce our project to the mothers and fathers and the leaders of the Haus and Ball culture and community before we even conduct the phase 1 activity. Last slide. And I had a great opportunity to meet our team in person earlier this month at the Ahmad Institute, and it was such a wonderful opportunity to, we've had ongoing discussions via Zoom, but such a wonderful opportunity to meet people in person. So I'm looking forward to our project together. I went a little over, but appreciate it.
No problem. Thanks, Jay. It's great. You can queue up the next presentation. It's so great to get to hear and learn about everybody's work, because we don't really get the opportunity to do this very often. So Rafi, Dr. Landovitz.
Thanks, Dr. Swendeman. I appreciate it. And I just want to say, I love, Jay, how your community feedback, community partner feedback really informed the name of your project. We had a little bit of a similar experience. I'm presenting on behalf of Corrina, Moucheraud, and Terry Smith, who are our partners and co-investigators in this project, which is the EHE-funded financially incentivizing strategies for HIV prevention in high-incidence populations in LA County, which I'll tell you about in just a second. But we had come up with an acronym that we thought was kind of catchy, and when we presented it to community partners at APLA, it was brought to our attention that there were some negative connotations to the acronym that we had chosen, so we changed it. So this is now called TIPS, T-I-P-S. So hopefully, if anybody knows of a negative connotation of that, please let us know. We did try and vet this before picking it, but I think it's really important community feedback, and names can make you or break you. So I think, Jay, really great to hear about what you came up with. I love it. Next slide, please. So the background of this project, can we advance, please? Is the obvious observation, and we've been talking about this, so I won't belabor it, is that PrEP use as an HIV prevention strategy really remains suboptimal in populations that could benefit greatly from it. And this includes young people, sexual minority men, and Black and Latino populations. Advance, please. Also, a lot of young people don't know their HIV status, and therefore, advance, please. We made the observation that a lot of health behaviors that you might think that people would want to pursue anyway, but for various reasons can't, don't, or won't, have been sort of enhanced or facilitated by tying financial incentives to those behaviors. And some examples that have been really successful in the literature have been, if you stop smoking, I'll give you some money. If you meet some weight loss goals, I'll give you a gift card. And these have been called variably conditional cash transfers, and by a number of other names, depending on their structure. But the evidence for their use in HIV prevention is relatively sparse. And the county division of HIV and STD prevention services has programs that currently are in place that use this concept of financial incentives to support ARV treatment adherence. So we were thinking that it would be a really nice companion program if we could create data that supported its use in prevention services. Advance. So the idea was we wanted to think that if we're going to propose or try and design an HIV prevention strategy that would use financial incentives to support prevention activities, we really need pre-implementation work to show that these are being done in a way that makes them applicable to most affected populations. Next slide. So this is where the new study comes in. And again, this is called TIPS. Let's advance. So the study has three aims. The first is we're going to identify which characteristics of these so-called cash transfers, and I'll tell you a little bit more in a second. The question is, should they be used to support PrEP use itself, or really for the overall HIV prevention goal of maintaining an HIV negative status, leveraging whatever combination of HIV prevention strategies are going to be best for an individual. And specifically, we decided to focus on young Black and Latino sexual minority men in Los Angeles County. Next bullet, please. Then we're going to, once we've done that through a series of key informant interviews, about 20 of them, we're going to create a discrete choice experiment based on what we learned in AIM 1 and identify what design of a cash transfer intervention for these HIV prevention goals, and talking about what should be incentivized for this population. And then finally, next bullet, we're going to take what we learned and bring it back to the communities who helped us develop this, and also to county stakeholders to try and see, is this information sufficient to develop a program and do an implementation science project that is so-called a type 2 implementation science objective where you try a program and evaluate it at the same time. And the question is, will there be sufficient data from this to do that, or does some additional work need to be done? Let's move to the next slide. So this is the study team. Corrina Moucheraud, who wasn't able to be with us today, from the School of Public Health, and I are the co-PIs. We have some outstanding research assistants. Terry Smith is our community PI who's been working with us at this from APLA. He works currently, he's had a number of roles at APLA. Many of you know and love him as we do. He's currently out here at the Baldwin Hills location, which is focusing on HIV and STI testing in exactly these populations in the South Los Angeles area. And our DHSP partner is Wendy Garland. Next slide. So the first aim, and this is what we're doing right now, is, as I mentioned, we're doing semi-structured interviews with about 20 HIV negative young, and we define that as age 18 to 34, non-PrEP using Black and Latino cisgender sexual minority men. And the goal of this is really to learn about, would a cash transfer intervention be acceptable to this population, and what attributes, if we were going to try this, would be most appealing. And I will share with you that when we got some feedback from our community advisors when we were starting this up, we were really cautioned to be really careful that in incentivizing an HIV prevention intervention, you don't want to unintentionally create stigma around receiving an HIV positive diagnosis. And so sort of partnering this with a companion program like the one that the county is currently doing that has cash transfer programs for people living with HIV and supporting their adherence, I think is critical to prevent there from being stigma associated with a more one-sided approach. Next slide. Once we complete this portion in the spring of next year, what we're hoping to do is do these discrete choice experiments with about 300 HIV negative young, defined the same way, non-PrEP using Black and Latino cisgender sexual minority men, that really proposes these hypothetical choices and ask people which one they would like better. And if you do this enough times across enough people, you could see which details are most important to people's choices. Next slide. And then finally, as I mentioned, we're going to take this information, synthesize it, and return it back to the communities who have helped us get to this point and help us conduct this research. And then we're going to be feeding it back also to policy stakeholders and potential consumers and care providers to get their input about what they think about the viability and feasibility of such an intervention. Next slide. So what's going to come out of this? So scientific results, I think, are not surprising. And we're going to share this with DHSP leadership, County of Los Angeles Commission, the CHIPTS and APLA CABs, APLA leadership, and that includes both written, technical, and lay language reports, infographics that we had talked about are so critical to dissemination, and also with communities through social media and town halls that we'll also record and distribute in that way, and of course, scientific publications and presentations. But then the question is, are these data sufficient to inform the design and evaluation of an actual intervention that could be part of prevention services? Next slide. So please, I'm happy to answer any questions. Please let people know that we're in the formative stages of doing this interviews, and we're happy to answer any questions. Anybody who is interested in being a part of any part of this study, this is our email and our phone number if you want more information, and our QR code for even more information. So thanks for your attention. I'll stop there and happy to answer any questions in the general question period.
Great, thank you.